Hello, my friends. Welcome back to the channel. This is episode 2 of hip mobility series, and today we're covering hip abduction with a bit of a rotation. So grab a block, some cushions, and medium resistance band, and also 3-4 kg dumbbell, and let's get started. Okay, guys, so we're starting in a sideline position with hip cars, controlled articular rotations. So lie down on your side with a block or cushion below your rib cage and support your head. Okay, we're going to be moving the hip through full range of motion. So as you can see, I'm sending my leg backwards, knee traveling down to the floor for abduction, and then you're reversing. So hip extension, then the kneecap travels to ceiling. I'm trying to abduct and then externally rotate. So like you're bringing your heel towards your chin. And we're going to take a little break here, or a little pause, just so we can focus on just encouraging more a rotation, more abduction. So breathe, you're using your hand to push the thigh bone away from you. You may feel quite a deep stretch through the side of the hip. And then we crack on with, again, movement, articulating that joint. Stay really still through your upper body. Push your head down, push your ribs down, push your lower leg down into the mat. And just continue with that movement of the hip. Going into external rotation and flexion again. And quick pause, pushing thigh bone away from the chest. And then again, control. So we moving through range of motion actively. Don't let the lower back move. Okay, maintain a bit of irradiation, like stiffness and rigidity through the middle back and lower back. And we're coming back into external rotation for a third pause. I strongly encourage you to do 5 to 10 rounds of this, especially if you're new to this. You can take pauses, but you don't have to. Okay, we're going to shortly move over to the other side. Again, review the positioning. Rib cage supported. You can use a blanket, a little towel, or a soft block. And obviously you want the head supported, so the neck stays in neutral position. Deep breath in before you start, a bit of irradiation. So we trying to ensure that lower back and pelvis itself does not move, so that we're truly isolating the hip. Remember, the better the hip functions, the less you depending on the lumbar spine. So improving the hip will save your lower back. I'll leave you to it. Follow along before we move on to the next one. Next drill, we're moving to hip swivel. So stay on your side. I'll look at the positioning where hips are no longer at 90 degrees. The angle is a little bit bigger. So we start with sort of like a clam position. So heels are together in space. And you'll be going from clam position, external rotation, to internal rotation. So notice that both of my feet are moving. So you're actually performing movement through both hips, even though the top hip moves so much more. You can do as many rounds as you wish. I would go for at least 10 rounds. So here we're targeting the abductors of the hip, glute minimus, glute medius, anterior and posterior fibers, as you kind of rotating the hip on top of simply abducting it. Now prepare for progression or the next step. We are now straightening the leg in abduction. You will perform very similar movement, rotating internally with toes to the ground and externally with toes and kneecap turning to ceiling while maintaining abducted position. That will really, again, target abductors of the hip. You will feel quite a lot of fatigue very soon, especially if you're going one drill after the other. Now finish off and prepare to do the other side. I will leave you to it. Into the next one, hip abduction in side lying position, but with hips in 90 degrees angle. You will be using 3-4 kgs to load the thigh and glutes. So the weight stays slightly above the knee on the side or outer side of your thigh. So you want to keep the weight quite close to the knee so you actually have longer lever. Okay, so lift, hold, and then descend slowly. I like to count 4 or 6 so that eccentric movement when the muscle is lengthening is a little bit slower. So concentric moving up is faster, descending is a little bit slower. And again, I assure you that with 10 reps and after doing all the drills one after the other in a row, you will feel this burning. And finish off, turn around, and go for it one more time. All right, off to the next one, side kneeling. The positioning here is a little bit more challenging. You may need a little cushion below the knee to support your kneecap and maybe block below your hand. Since we're trying to focus on the top hip and leg, performing the circles, try to stay really rigid through the midsection so there's no rocking or movement of the rib cage and head. You want the leg to stay as close to the level of the hip as possible. Take a little break for that hip and then move on to the next one, which will be your bicycle. So we're trying to maintain abducted position through the top leg. You will feel the lower hip as well as it's still abducted. Now, top leg will be moving in a horizontal plane. So imagine that leg is sliding on the flat surface, like on a table, and you're performing flexion, straightening the knee, pointing your toes forwards, and then sending that leg behind you, trying to extend the hip. Bend the knee, heel to the sit bone, and perform that full bicycle motion again, keeping in mind that this is all about holding the leg in space. And then change direction, so you're cycling backwards with the same cues. And finish off your side kneeling. We are turning around. Let's work on the other hip. Moving on to the last drill, we're going to be in the bridge. You will need a band for this one. You will wrap the band around the shins, so upper calves, right below your knees. So if you've got a loop, great, use a heavy one. If you've got a heavier or medium band, wrap it right below your kneecaps, lie down on your back, and heels below your knees. All you're doing is getting yourself into the bridge position, shoulder bridge position, and you're sending knees apart. So we're abducting and we're adding a bit of external rotation too. So your feet roll out to the outside edges as you're stretching the band. Pace-wise, you may want to stretch the band and hold maybe 3 to 5 seconds and then returning slowly. This is a great drill to consider as a warm-up before your workout if you're planning on doing especially unilateral stuff that require a lot of firing of a glute medius, like step-ups or split squats or lunges. And as a progression, you may want to consider little pulses in the end range of motion, so knees as wide as you can and just pulsing. Again, thanks so much for watching. Please subscribe for more content and look after those hips of yours. Ciao!